Do you incorporate the notion of the unconscious in your theories and your work?
Well, there's no question that there are processes that take place in the mind or the brain that are not conscious. The idea of psychoanalysis is that there was a seething cauldron underneath filled with all kinds of id wishes, kind of nasty wishes, dirty wishes, and so on, things that were not acceptable. And so one would put a layer of repression and try to keep down these wishes, and then every once in a while they'd pop up through the repression and you start to get symptoms. So that's one concept of what Freud called the unconscious. On the other hand, there are unconscious processes that take place, and even some kind of learning that takes place may be at a non-conscious level. Now, you mentioned bias. For example, if you have a depressed patient and you show him a negative picture, if you flash something on the screen for 1/100th of a second, the individual is not going to see this negative thing, won't be able to decipher it. But if at the same time you're either taking brain waves or taking a GSR, taking the pulse and blood pressure, the person is still responding. And this is even more true with anxiety, that if you show an anxious person some kind of an anxiety or some kind of a threatening picture, they may not see it, they may not be conscious of it, but through some non-conscious automatic process, they're able to respond.